You're welcome back to my channel. I'm your friend No Solution, and this is a page you can always come back for your health tips. Let's talk about the risk and the causes of womb cancer. Being overweight or obese is one of the biggest risks of womb cancer. There are some other risk factors that increase your risk of developing womb cancer. Like I said, womb cancer is also called uterine cancer because this is because the uterus is the medical name for the womb. You may also hear some people call it endometrial cancer and all that. What is a risk factor? Anything that can increase your risk of getting a disease is called a risk factor. So different cancers have different risk factor. Having one or more of this risk factor doesn't mean you will definitely get the cancer. Then age, the risk of womb cancer increases with the age. Most women diagnosed with womb cancer have been through their menopause and are like age 75 to 79. Being obese or overweight is the biggest preventable risk factor for womb cancer because being obese or overweight causes around a third of womb cancers. High level of estrogen. This estrogen is just a female hormone. Before the menopause, the ovary makes most of the estrogen. A woman needs along with another female hormone called progesterone, which regulates women's reproductive cycle. So what now happens is that after menopause, the two ovaries stop producing hormone, but the body continue to make small amount of estrogen. Fat cells also make estrogen in women. Fat cells. Estrogen now causes the cell in the womb to grow and divide. Cancer happens when there is a mistake, when the cells are growing and dividing without no control. So if there are more cells, it increases the risk of mistakes happening. Anything that increases the amount of estrogen in your body increases your risk of womb cancer. So, women who are obese or overweight have higher levels of estrogen than those who are not. Fatty issues produce more estrogen. So, the more body fat you have, generally, the more estrogen you produce. The more estrogen you make, the more the womb lining builds up. When more lining cells are produced, there is a greater chance of one of them becoming cancerous. Hormone replacement therapy, HRT. There are different types of hormone replacement therapy. Estrogen only, hormone replacement therapy increases the risk of womb cancer. This is why doctors usually prescribe estrogen only for women who have had surgery to remove their womb or hysterectomy. Then they prescribe tamoxifen, which is an hormone therapy for some type of breast cancer. It can increase womb cancer risk. It appears to have a similar effect to estrogen on the womb. But though this is a real side effect of taking it. Then what about diabetes? Several studies show a higher risk of womb cancer in women with diabetes for both type 1 and type 2. This link may be due to being overweight. We need more research to find out why it increases the risk. Then if there's thickened womb lining, endometrial hyperplasia is a non-cancerous benign condition where the womb's lining becomes thicker. You have a higher risk of developing womb cancer if you have atypical hyperplasia. Then we have PCOS, polycystic ovarian syndrome. And women with this condition have a hormonal imbalance, which may cause very irregular period. Menstrual history. Some factors linked with period menstruation can increase your risk of womb cancer. This is because they cause higher levels of estrogen. And when it happens like that, this one can include starting your period at a young age or a late menopause. Family history of womb cancer is associated with an increased risk of all endometrial cancer, which may be due to genetic factors, but research is ongoing to understand this better. So, and there's something we call Lynch syndrome. If you have a family history of Lynch syndrome, you may also be at an increased risk of womb cancer. And what do we mean by Lynch syndrome? Lynch syndrome is an inherited faulty gene. It is linked with an increased risk of several cancers, including womb cancer. Out of every 100 women who carries gene fault, this gene fault, up to 49 will develop womb cancer at some point in their life. Having had children decreases your risk. Study shows that having children lowers womb cancer risk. The risk decreases with the number of children a woman has. So if you have any issue, kindly talk to your doctor. See you.